Welcome to People's Choice by Intermountain Healthcare. Let's move on to question number 3. What part of healthcare affects your overall experience the most? Remember, we asked 50 people that question. What do you think their top answer was? Todd.
I think the clinical care that you get from the physician or the provider.
Clinical care survey says interaction with doctor and staff.
There
Judges,
you go.
does
Yes.
that qualify?
That's right.
That's right. Of course.
He really wants to win
That's
something.
what
It
I
is
was
right.
saying.
You are right.
Let's see the responses to 2 and 3. Competency of staff and the actual clinical outcomes. Interesting. So, Todd takes the round because our judge is super generous.
Oh, come on.
It was right.
Let's talk about this a little bit. So as it turns out, the top response, my interaction with doctor and staff, was overwhelmingly the top response. So why do you think that is, first off?
If I'm a lay person and I don't know healthcare, that's all I can judge. That's all I can perceive is how the doctor treated me, how the staff treated me. That's the only way I know whether my healthcare was good or not, and did I get better. I think some of the things that we have done is when you walk into a patient's room, you introduce yourself and what your role is. So I don't have random people coming into my room. I had my father in the hospital a couple of years ago, and a CNA came in, took his arm, put the blood pressure cuff on it, took his blood pressure, got it, documented it, and walked out of the room, didn't say one word to him.
Wow.
Now, we knew what that CNA was doing, but she didn't introduce herself. She didn't even make eye contact with my father. That's changed now. We don't do that anymore. But that interaction with the patient is what they see, and that we can train to that. That's a skill you can train to.
Well, because it's so important, then how can you train? How can you?
You practice it. You practice it, you observe, you validate, you set expectations. You know, it's not easy for everybody to go into the room and introduce themselves. Some people, that's very hard. So you practice it with each other. And then you have observations. Hey, I'm going to watch Eva's going into Mr. Jones's room. I'm going to sit there and watch and see if Eva does that. And then if Eva comes out and she didn't do it right then, I coach and mentor Eva. Hey, next time you go in, introduce yourself. I know that's hard. Let's make sure we do that. So you just coach and mentor as I do that.
So how do new technologies and tools help clinicians do this?
I think you can engage the patient in a very different way. And physicians, when they round, and other clinicians as a whole, they would round, they walk in the room, they remain standing, they talk for a couple of minutes, and they're on the way. And the patient still has things they want to ask, but we may not slow down long enough to give them the chance to interact, or the standing over them as opposed to sitting down, sitting in front of them, pulling the screen over and talking about the lab results and letting them relate to how they're progressing in their care, but sitting at their level, eye to eye, talking to them as opposed to standing over them and then walking in and out. It's slowing down and engaging the patient as opposed to the fact I've got to get to the next patient.
I actually think what's kind of cool about physician order entry or bedside computers is I literally can sit there with my patient right here and talk through what I'm doing on the computer. Okay, I'm putting in your assessment. When I listen to your heart rate was really strong and even, and the nurse is documenting that, or the physician is documenting that, and you're interacting with the patient at the same time, so the patient knows exactly what's going on.
It's a great point. Great use of technology. Todd.
So I think we all deserve to be treated with kindness and respect. It doesn't matter whether that's in healthcare or any part of our life.
It's a novel
so
idea.
I think that as a patient, and I put myself in that position, I want to understand that somebody cares about me. And sometimes that's demonstrated by how they treat me. If they're kind to me, polite to me, and then they, respect me in my particular circumstance and demonstrate that by the way they interact with me. Sitting down so that they're eye to eye, having a conversation with me about my particular situation. I think the technology helps to improve that because it provides, key indicators or information about a patient. I can better understand the patient's name. I can better understand the circumstances that may have brought them there. And then to take that and represent that in a kind and respectful way, well, the technology is going to help me be better at doing that. And so I think it's in my best interest to take a few minutes, review that information about the patient that I'm going to have an interaction with, and then demonstrate that I care about them by representing it when I'm talking to them.
Great points. Todd, tell us from a non-clinician's perspective, how does what you do affect the patient's experience?
Well, certainly when we're having a conversation with the patient after they've gone through the clinical care, and they now have reached a point where they may have some financial obligation left over, to talk with them in a way that helps guide them to find the resources that are available, particularly Intermountain Health Care, that can help them satisfy that financial obligation. It can be a warming and comforting thing to them to understand that we're not just going to come after them to collect that balance, but we have ways that we can help them, to help them find a way to satisfy whatever their financial obligation is. And we do that all the time at Intermountain Healthcare within the revenue cycle.
Great points. Any last thoughts on this topic?
I think there was an organization that implemented an EHR. You had to make it human for the clinicians as well. And this organization was Naples in South Florida, and they called their system Elmer. And when the nurse entered the room, she would say, "My name is Mary, and I'm your nurse today, and this is Elmer, and he's helping track what's going on with your care so other providers that are coming to see you understand how you're doing and how we're progressing so we communicate more effectively." And it brought the patient and the nurse into a bi-directional conversation, but making Elmer a part of the care team.
Well, believe it or not, we had a 3-way tie, so I guess everyone wins. Congratulations. Thanks again for joining us for People's Choice by Intermountain Healthcare. We'll see you next time.